we made a name for ourselves with rhinoplasty, but we really love doing facelifts, and I think we do a really good facelift. The key is to really create a natural change, and I think that's what a lot of people want. They don't want to look different, they just want to feel like they've turned back time and have that younger, more youthful neckline, and the key to that is really having the right approach to a facelift.
Yeah, when we're talking about facelift, I think there's the things that you want to have happen and the things you really just don't want to have happen. So really important, what we do is not a skin lift. We're not going to go in there and just pull the skin back. Most of the actual work is underneath the skin, in the SMAS layer, the muscular layer of the skin. When you elevate that tissue, place it back into the rejuvenated place where you originally were, and suture that into its proper position, and then you lay the skin back in place and remove the excess skin. You don't have to worry about that excessively pulled, windswept look.
The key is really to have that tension on the deep tissues, and that way the skin can just lay down. We can take away the excess skin, but there's no pulling, there's no tethering, there's no change in the ear position afterwards. The incision as well, we've learned over many years of doing this that we've seen a lot of patients where they have the traditional facelift incision that goes way up into the hairline, into the temporal area, and that can sometimes result in an unfavorable change. You can see the temporal hair tuft pull upwards, you can see some hair loss or poor scarring in that area sometimes. So we've done away with that. Our facelift technique uses a shorter incision, which just starts just around the top of the ear, and by doing it that way we're still able to access the entire area to really rejuvenate the jawline and the neck, but the incision heals very quickly with minimal scarring.
Yeah, it's really important. What we like to do is distinguish between the lower, middle third, second two-thirds of the face and the lower neck versus the brow lift area. There are patients who think, hey, as long as I'm getting a facelift, let's carry that incision up into the temporal region and get this little pull up in here. All that generally ends up doing is causing a pretty bad scar in here and elevating the temporal hair itself, so you can't really wear your hair up like you like to. That never needs to happen. The procedure that we do will always be individualized to your particular problem. So depending on where and how heavy the skin itself is, how heavy your own face is, what the extent of loss of tissue elasticity is, we can have a more extensive conversation about what needs to be done. The wonderful thing is that we tailor the procedure together, and working together we really are able to minimize the amount of time you have to be under anesthesia.
And that makes recovery a lot quicker. There's a lot of hype these days from a lot of patients wanting the quick fix. And you see a lot of marketing for these short scar facelifts where you can go in and do it all under local anesthesia and be back to work within a couple of days. And the truth is that those short scar facelifts are not really all that effective. You get what you pay for in the sense of the amount of dissection that happens and the amount of lift that happens is far inferior to what we're able to accomplish through our lift without a significant increase in recovery time for us.
Yeah, absolutely. It's really important. People hear about all these different types of downtime, lunchtime lifts. It's important to understand that those lifts really won't last, and you're spending a fair bit of money. What you're really getting is what was previously called a tuck-up procedure. So it's something most surgeons would do for you as a secondary procedure. With anybody you talk about facelift, there's a maybe 5–10% need for a tuck-up a year or two afterwards, where hey, you get a little bit of a sag back in here and you go back and make a short lift incision and elevate this tissue. To go in and pay $7,000, $8,000, $10,000 to have that as a primary procedure, you're doing yourself a disservice. The results won't last, and you're not going to be back into the same place a year later.
Now that type of perhaps slightly less extensive lift might be appropriate for someone who's maybe in their early to mid-40s, who's starting to see just the earliest sign of a little bit of jowling, and they want to address that now earlier rather than wait a little bit later to have a full face and neck lift. And so for those patients, we might have that discussion, and it's worth consideration. Even then, what we're actually doing underneath the skin is more extensive, and that's what matters. So we're creating a change that's going to last, and that's really going to look natural for many, many years to come.
Yeah, it's important to understand when you're talking about that lower facelift, what we're talking about is doing a small incision down here, doing what's called a platysmoplasty, where we're really tightening the muscular tissue down here as well to really fix that neckline, get it back to where you always were. We always like the analogy of a hammock. When you're dealing with the lower neck area, what you have to think about is as you've aged, as we all age, the tissue and muscle tends to spread out. What really needs to happen is first in this lower neck area, that muscle has to be re-overlapped and sutured into place, and that way when you're actually doing all the work from here, you're lifting against tighten muscle already, so you can really get a fantastic lift. It's a really funny concept that we see all the time with our patients is right after surgery, most of the patients are like, oh my God, I can't even barely move my neck, it's so tight. And then at about 3 months, that things start to relax again and you're able to turn your neck, and patients will sometimes joke, hey, couldn't have gotten a little bit tighter? And that's always kind of funny.
And we remind them, hey, you remember what this was like the first week after. But that being said, the recovery is really not bad. You know, most people will complain of feeling really tight for a good 2, 3, maybe 4 days after surgery. You might need some pain medication for a couple of days. But usually within the first week, you're up and around, you're getting back and moving around and getting back to some light activity, and most people are comfortable going back to work or going back to social activities within about 7 to 10 days at most.
If you're interested in a facial rejuvenation procedure and neck lift, we welcome you to come in. We'll talk about all the different options, the different types of facelifts that are available to you, as well as occasionally doing things like fat transfer to get some volume enhancement at the same time. So these are all things that we talk to you in depth with when we